I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. Have you ever had trouble falling asleep or staying asleep? If so, you've got a lot of company. What can you do? This is the People's Pharmacy with Terry and Joe Graydon.
Experts recommend at least 7 hours of sleep a night for adults. Over 1/4 of Americans do not achieve that goal.
How does skimping on sleep affect our health? You may be surprised at how many conditions are worsened by inadequate sleep.
Why can trying to force sleep make insomnia worse? What are the downsides of sleeping pills?
Coming up on the People's Pharmacy, the sleep reset. How to fall asleep and stay asleep.
In the People's Pharmacy Health Headlines, a scientific conference last week was devoted to research on alpha-gal syndrome, the meat allergy triggered by tick bites. This mysterious delayed reaction was discovered about 20 years ago. It's been spreading very rapidly in the Southeast. According to a recent study, 1/4 of people tested in Arkansas, Missouri, Tennessee, Kentucky, and Virginia were positive for the alpha-gal antibody. Only a minority of people with antibodies have clinical symptoms, though. This antibody is a response to the alpha-gal sugar that occurs in the blood of mammals other than primates. When a tick bites, it injects the sugar into the bloodstream, and the immune system responds by creating antibodies. If the person then eats meat, or in some cases dairy products, the body may react with an allergic response ranging from hives or digestive distress to anaphylaxis.
Bone loss represents a serious complication of menopause that's due in part to reductions in estrogen. Australian researchers wondered whether a probiotic supplement containing lactobacilli would slow bone loss and improve bone density. They recruited 114 postmenopausal women and assigned them to either placebo or probiotics. After a year, both groups had lost some bone density. Unfortunately, those taking the probiotic supplements lost slightly more than those on the placebo. The authors concluded that their randomized controlled trial found no evidence that 12 months of lactobacilli combination supplementation improves bone health.
Shingles is a painful skin condition that can affect a person decades after a chickenpox infection. As painful as the original shingles attack may be, the aftermath, called postherpetic neuralgia, can be excruciating and seemingly endless. Doctors have only a few methods to help sufferers ease the pain. Now, researchers in China have proposed one more tool. They tested electroacupuncture, a modern modification of a traditional technique. In traditional Chinese medicine, very thin needles are inserted into the skin at specific points on the body. In electroacupuncture, these needles are used for electrical stimulation. The study lasted a month and compared electroacupuncture to sham electroacupuncture in 448 individuals with postherpetic neuralgia. Pain scores came down modestly for the people getting electroacupuncture. A significant number of these people reported at least 30% less pain.
The World Cup has generated tremendous interest in soccer, otherwise known as football around the world. If you watched any of the matches, you would have seen a dramatic maneuver known as heading, in which a player bounces the ball off his head, sometimes to score a goal. What's the impact of heading on that brain? A study published in JAMA Neurology this month examined the effect of heading upon biomarkers of neural damage in high-level amateur soccer players. High-impact headers were linked to increases in blood biomarkers p-tau and S100B. The authors conclude that amateur-level heading may actually affect brain integrity.
Most people know that severe sleep deprivation has an impact on next day functioning. Not only do you feel dopey, you may also feel hungry and eat more than usual in an attempt to stay more alert. But what's the impact of skimping on sleep just a little, as so many Americans do? A new study suggests that this habit could also lead to some overeating. The investigators recruited 95 adults who usually sleep 7 to 8 hours. During part of the study, they maintained that pattern. In another part of the study, volunteers delayed their bedtime by 90 minutes. Researchers monitored sleep and activity levels, body weight, waist circumference, body composition, and hormones. Sleep-deprived people tended to be more sedentary and they also ate more, so they gained about a pound on average during those 6 weeks. Over the long term, this could lead to weight gain. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. Do you ever have trouble falling asleep? A lot of people toss and turn when they go to bed. Others fall asleep easily, but wake up at 2 or 3 a.m. and can't get back to sleep. Having us tell you that sleep is critical for good health does not help. It could make you even more anxious about lying awake.
Today we'll find out just why sleep is so important for our health, and we'll also learn how to deal with sleep difficulties.
To learn more about this, we're talking with sleep expert Dr. Roger Schwelt. He is Associate Clinical Professor at the University of California, Riverside School of Medicine and an Assistant Clinical Professor at the School of Medicine and Allied Health at Loma Linda University. Dr. Schwelt is quadruple board certified in internal medicine, pulmonary diseases, critical care medicine, and sleep medicine through the American Board of Internal Medicine.
Welcome back to the People's Pharmacy, Dr. Roger Schwelt.
And good to hear you as well.
It's great to have you back on the People's Pharmacy, Dr. Schwelt. You're one of our most favorite guests because you can explain complex medical issues in language that people can actually understand. Now, I understand that you are a sleep medicine specialist, and I think the very first question has to be, why? Why is sleep so important for good health?
Yeah, it's really, if you think about it, all of the other specialties of medicine deal with the 2/3 of the 24-hour period that you're awake. Like, let's just, surgery, pediatrics, all of these things are issues that occurring, that we find and have symptoms when we are awake. And there's only one specialty of things that deal with what happens when you're not moving, when you're not awake, when you're not thinking and you're sleeping. And it's very important, this period of time, because everything else that happens during the day is dependent on whether or not things that are supposed to happen at night and or when you're sleeping are actually happening. So it's extremely important.
So, Dr. Schwelt, what is supposed to be happening at night? I mean, you go to bed, you close your eyes. What else is there to it?
Exactly. Well, this is what it looks like on the surface. But the analogy I like to use is an analogy that it can break down, but it actually has a lot of parallels. I used to have a friend, I still have that friend, who worked at Disneyland when we were in high school. And he would go at night. And he would tell me all sorts of stories that would happen and what they would do at night. Like, they would shut down the park, the guests would leave. He was part of the crew that would, clean the streets and clean the gum off the ground. But there were also gardeners that would weed. There were engineers that would shut down the rides. There were people that would check for cracks in the rides. And the structural integrity. The gift shops were restocked. The cashiers were, emptied, and so forth. And the reason why all of these things could happen is because there was no guests in the park. Because when there's guests in the park, you have to have a special veneer of happiness and all of these things that are happening. And that's not the time to be, in line for It's a Small World and see a gardener out there gardening in the in the flowers. So when 8 o'clock in the morning rolled around and you walk into the park, it is the most beautiful it's ever going to be, because it's just had a whole restoration that has occurred at night. So the human body is far more complicated than Disneyland. And there are processes in our body that are involved with rest, repair, rejuvenation, and all of those things are linked to each other. So that if one of those things is not happening, you're not going to get the best night of sleep, and therefore you're going to be prone to the problems that are associated when you don't have rest and repair mechanisms working perfectly. And ultimately, that's going to be disease and death.
Such as?
So we have very good evidence that people who don't sleep well, who don't sleep long enough, who are exposed to light, these are all things that are the antithesis of sleeping well at night. They have, let's face it, they have increased risks for diabetes, they have increased risk for cancer. New studies have shown that their risk for death goes up. So this is really important. We need to know why this is happening, but we need to know what we can do to prevent this from happening to ourselves.
Now, we've also heard that people who don't get a good night's sleep may have more cognitive dysfunction, more obesity, more immune problems, more hypertension. All of that, I have to be honest with you, sets an awful lot of people, because it's like 50 to 70 million people have sleep problems. It sets them up for anxiety. So now they're worried that all these horrible things are going to happen if they can't get a good night's sleep. And so they have a hard time falling asleep.
Yeah, and you're touching on exactly a problem that we have in dealing with people who have difficulty sleeping, because the ones that come to see us are the ones that are most concerned about it. And we actually have a term called psychophysiological insomnia, which is just a long word of saying people who can't sleep because they're worried about the fact that they can't sleep. And so, yes, absolutely, it can be a vicious cycle. And we have to put it in perspective that these things that happen when you can't sleep very well, they don't happen overnight. So, there are some physiological things that we'll talk about that we see like after just one night of doing an all-nighter. But the long-term problems associated with chronic sleep deficiency don't occur until years down the road. So this is something that that we have to put in perspective, and notwithstanding what you've just mentioned there it is a serious situation, and we do need to address it.
Now, Dr. Schwelt, probably at least half of those people have heard that you shouldn't be looking at your screens just before you go to bed. You should turn off the TV. You shouldn't look at the computer. You shouldn't be on your phone, especially you shouldn't be on your phone doom scrolling social media. So people know this, but a lot of them do it anyway.
Yeah,
How come?
it's like smoking. I have people that come to me with lung ailments, and they've heard it before. In fact, if they don't hear it from me, it's almost permissive. You need to stop smoking. They know they need to stop smoking, but the problem is that smoking is addictive, and so is this doom scrolling, this screen. These things that are produced, the things that are produced to be put on the screens that we watch, are specifically designed to keep us watching. And we have to be cognizant of that. And so we have to put things in place so that we're not caught doing this. And there are actually apps now that are being developed, and even on the devices that we get that actually help us take back control of our lives and limit the amount of screen time that we're doing.
Well, tell us a little bit more about that, because I think people are interested in how they could break the cycle. I know, for example, my computer it takes on a pink glow around 9 o'clock at night. So I know I shouldn't be looking at it when it's pink.
Yeah, so the best thing to do is to not look at any light at all. And of course, sometimes we have to, because things have to get done. We live in a very fast-paced world where things need to be completed. And when we do that, we're sort of robbing ourselves of a good night's sleep. But the second best thing would be to have the blue tones in those lights sort of reduced. So that would be the next thing. People tend to like wear, for instance, blue blocker glasses at night. And that's certainly something that people can do. Unfortunately, the data shows that if you had to choose between doing red light or blue blocker light, that type of thing versus no light at all, it's much better to have no light at all. And some of the things I was talking about before, where we have some of these things that are put on our devices, I'm talking about screen time limitations, where it will literally come up and say, no, you've exceeded your time, you're past this time. I mean, you could always override it, of course, but they're putting in more deliberate items into people who are health conscious, into their devices, to remind them and to empower them to overcome some of these addictions with scrolling and looking at videos.
Dr. Schwelt, we just have a couple minutes before our break, but I do want to ask you about diet and sleep and how they affect each other. I remember Dagwood Bumstead, that cartoon is on the same nationally syndicated organization that syndicates our newspaper column. And Dagwood would always have a Bumstead sandwich late at night. It was so big you could barely imagine getting your mouth around it. What happens when we eat close to bedtime?
Well, when we eat close to bedtime, we confuse our circadian rhythm. The two biggest Zeitgebers or inputs to our circadian rhythm, which simply sets up this idea of, are there people in the park or are there not people in the park? And that determines what goes on in the park. With the Disneyland analogy, if we're eating food, if we're being exposed to light, our circadian rhythm thinks that it's daytime, and it's not going to activate those genes, those processes that are so health restorative. So confusing the circadian rhythm is never a good idea. And this idea about sleep and diet go both ways. So bad sleep can actually cause you to have a bad diet, and a bad diet can cause you to have bad sleep. So interrupting that vicious cycle is really important. There was a study that was done showing that slow wave sleep reduction, this is the very important type of sleep that we get at the beginning of the night, that's physically restorative. In a randomized control trial where they reduced that type of sleep by inhibiting it, this increased the risk of diabetes and insulin insensitivity in those subjects.
Well, when we come back from this break, we're going to ask you when we should stop eating in the evening and what we should be eating for a good night's sleep.
You're listening to Dr. Roger Schwelt, Associate Clinical Professor at the University of California, Riverside School of Medicine, and Assistant Clinical Professor at the School of Medicine and Allied Health at Loma Linda University. He is also co-founder and chief presenter of MedCram.com, Medical Lectures Explained Clearly.
After the break, we'll learn how diet affects sleep.
Are there foods that interfere with a good night's sleep?
A lot of us watch TV before going to bed, but it might not be the best idea.
How does slow-wave sleep affect the output of growth hormone?
How can you measure sleep quality?
How long before bedtime should you stop eating?
Should we avoid exercising too close to bedtime?
You're listening to The People's Pharmacy with Joe and Terry Graydon.
This podcast is brought to you in part by ButcherBox.
Does grocery shopping feel like a chore? I know sometimes we procrastinate our shopping for weeks, which means we run out of perishables like meat, chicken, or fish.
That's why we're so thrilled with ButcherBox. We've got plenty of quality protein sitting in the freezer ready for us to defrost, cook, and enjoy. So easy.
Our ButcherBox shipment arrived thoughtfully packaged, so all the 100% grass-fed beef, wild-caught seafood, and organic chicken arrived frozen solid. Unpacking it into the freezer felt like a holiday. It's comforting to know that ButcherBox takes care with sustainable sourcing. So we can feel really good about what we're eating.
And it is delicious as well as convenient, like having the neighborhood butcher in your own back pocket. In the morning before work, we can pick out what we want for supper and put it in the fridge to defrost. We've enjoyed yummy top sirloin and ground beef, and we're looking forward to salmon and scallops.
If you're looking for an easier way to get great meals on the table, give ButcherBox a try. Go to butcherbox.com/PPOD to get $20 off your first box, plus your choice of free ground beef for life or free chicken thighs or top sirloins in every box for a year, with free shipping always. That's butcherbox.com/PPOD. Again, that's butcherbox.com/PPOD. Be sure to use our link so they know we sent you.
Hi, I'm Jake Grez, also known as Nurse Jake. As a travel nurse, I've worked in all kinds of places, different settings, cities, and climates. Every assignment brings on a new challenge, which is why I always bring my figs. These scrubs are built for whatever the job throws at you. They're breathable, flexible, and comfortable in any environment. No matter where I land, I know they're going to keep me looking and feeling my best. And don't sleep on the details. The pockets, the features, the finishing touches, everything has a purpose, and it makes a real difference when you're moving nonstop. The fit is clean, tailored, and super polished, and they come in a huge range of colors. In other words, they feel great throughout a 12-hour shift, and they always look good. See every healthcare professional on Instagram. If you work in healthcare or know someone who does, check out Figs and get 15% off your first order at wearfigs.com with code FIGSRX. That's wearfigs.com, code FIGSRX.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by Sonu, an FDA-approved drug-free treatment for nasal congestion and runny nose, using sound instead of steroids this allergy season. More at getsonu.com. That's getsonu.com.
And by Spatial Sleep, a non-drug approach to help you fall asleep and stay asleep without medications. More information at spatialsleep.com.
Today our topic is sleep. Research has shown that getting enough sleep is a foundation for good health. We've also seen that sleep habits and diet are intimately connected.
Do you ever snack after dinner? Could that affect your sleep?
Many people experience heartburn after lying down. How can you prevent that?
We're talking with Dr. Roger Schwelt. He is quadruple board certified in internal medicine, pulmonary diseases, critical care medicine, and sleep medicine through the American Board of Internal Medicine.
Dr. Schwelt, I wonder if you could tell us what the impact of diet is on sleep. Are there diets that act against good sleep?
Yes, absolutely. In fact, we have good evidence. There was a study that was published in May of 2023 and may not answer all of the questions that we'd like to answer, but this was a randomized trial, and they actually made the diets isocaloric, which means that they had the same number of calories in each group. And not only was it a randomized trial, it was a crossover trial, which means that everybody acted as their own controls. So very powerful design. And what they did was they randomized these subjects to two diets. One type of diet was a high-fat, high-sugar diet, which I think most organizations would say would be unhealthy. And then the other diet was a low-fat, low-processed sugar diet, which was more in line with a whole food plant-based diet. And they did this for 7 days. They did each diet for 7 days, and then there was a 7-week washout. And then those that had one diet did the other diet, and those that had the other diet had the other one, vice versa. And so they were able to measure a number of different things, and they measured just about everything they could with respect to how they were sleeping. They were looking at non-REM sleep. They were looking at stage 2 sleep, stage 3 sleep. These are all particularly different stages of sleep that tell scientists things. They looked at the duration of the sleep. They looked at different parts of the brain. And they were able to come up with some things that were actually very statistically significant. And let me just read for you what the scientist conclusion was at the end of this study. They said, quote, "In conclusion, we herein provide novel evidence to indicate that exposure to a more unhealthy diet, higher in proportion of daily calories from sugar and fat, can impact several sleep parameters and are known to be associated with restorative properties of sleep in humans. As we also observed similar changes in sleep parameters during recovery sleep, which occurred after cessation of the two different diets, our findings raise the possibility that even a short-term dietary exposure can continue to impact the neurobiology of sleep over several days."
Now, I'm going to ask you to interpret that. Are they saying that if I have a bowl of popcorn and a bowl of ice cream while I'm watching, a terrific show on Netflix, that I'm going to have trouble sleeping that night?
Not only that, but that what also came about from this study was more subtle things. For instance, the amount of slow wave sleep. So there's a number of terms for this type of sleep. It's that important, and it's particularly more abundant in the hours before midnight. And it's called stage N3 sleep. Another word for it would be slow wave sleep or sleep delta power. All of these are terms that are used in the literature. And what it means is simply this very high amplitude, slow wave sleep that is specifically, especially in teenagers, tied to growth hormone. So you've always heard that expression, you need to get sleep if you want to grow tall. It's not a misnomer. We've seen that the hours of sleep before midnight, where we receive the majority of this type of sleep, is highly tied to growth hormone and physical restorative sleep. So that, and this is precisely the type of sleep, by the way, that we're actually losing out on the most when we go to bed late or when we eat late. It's this reduction, that this type of sleep that I'm talking about was particularly influenced when people had a high sugar, high fat diet.
Dr. Schwelt, I'm wondering, how do you measure whether someone is getting REM sleep or slow wave sleep? Are you looking at the electrical activity, the brain waves?
Yeah, so the gold standard is exactly that. I every day I look at what we call polysomnographies, where people sleep in labs and they've got a number of leads or wires hooked up to their head, and that's exactly what we're measuring. We're measuring these types of brain waves. However, there are other surrogate markers. For instance, your respiratory pattern, your pulse pattern, and so even today, you have these wearables that you can wear like a watch, and it will tell you, and fairly accurately so, how much of your sleep was spent in REM sleep, how much of it was spent in slow wave sleep. And so we can actually see that or get an estimate of what that is with regular devices that people can wear. But yes, ultimately, if we want to know specifically what's going on, we put wires on people's heads and actually measure their brain waves.
So, Dr. Schwelt, if you were in charge of my sleep, when would you tell me to stop eating? Do not eat after.
Yeah. So what I would first do is find out what time you feel sleepy, and and whatever time that is, I would say that 3 hours, at least 3 hours before that period of time. Let's say you get sleepy and fall asleep and go to bed at 10 o'clock at night. Then I would say the absolute last time that you should be putting anything into your mouth is about 7 o'clock. Some would even say earlier than that. In fact, I've had patients that have had issues with, for instance, gastroesophageal reflux disease. This is something seemingly unrelated, but it's actually quite related to our sleep. People don't understand this, but when you're walking around and you have food in your stomach, sometimes that food can reflux up into your esophagus. And some people can actually feel that very well, but others, they don't feel it at all. And when you are awake, what will happen is that your esophagus will push that food back down into your stomach. That's known as peristalsis. However, when you're asleep, that doesn't work as well at all. In fact, some people don't have any peristalsis and they don't move that down. And so reflux can be very disturbing for people who are sleeping and having this. And it can actually cause arousals from their sleep and fragmented sleep and very poor sleep. So in those types of patients who have reflux, I will tell them the same thing: don't eat 3 hours before bedtime. But in other patients where it's particularly bad, I'll give them a time like 5:30, 6 o'clock in the evening, which sounds very early, especially for us who are socially adept at eating food, in early or late in the evening. But I've had patients who have done that, just that one intervention, and that has made a tremendous impact on the quality of their sleep and in other factors as well.
One last question about food. The ketogenic diet. It's become quite popular. Is it better for sleep, worse for sleep, or no effect?
Well, I think the ketogenic diet is actually very beneficial. And for some people, in fact, the same person that I was just referring to in this situation, he had what we call long COVID. He had gotten a COVID infection and was having brain fog and difficulty sleeping. And one of the things that I told him, in addition to getting outside and getting bright sunlight, was to not eat after 5:30. Well, it turned out he also had this gastroesophageal reflux disease. Not only did his sleep improve, but I believe as a result of his sleep improving, he also was able to repair his body systems better, including the mitochondria. And his shortness of breath went from 8 out of 10 to 3 out of 10 in just a few weeks after doing that one simple intervention, after he had had this for over 2 years.
And briefly, and I know you can do this better than almost anyone, what is a ketogenic diet?
So, ketogenic diet is basically the absence of sugars, particularly that would prevent the body from making ketone bodies. So, when you fast and you have no caloric input, that's when your body is going to switch over to making ketones, because the brain prefers carbohydrates as fuel, but they will take ketones in addition to that. So here's the key, though. I think most people don't understand this. Most people believe that the only way you can have a ketogenic diet is by eating meat. That's not true. You can have a ketogenic diet by intermittently fasting on a whole food plant-based diet. And I think that's actually the best type of diet, is a whole food plant-based diet where there is a cessation of that input of complex carbohydrates at an early enough hour in the evening, so that you are basically going into a ketogenic type of state as you're falling asleep. And that's when you will have the maximum benefit in terms of restoration and health.
And when's the last time you should eat in that situation?
In that situation, again, I would say at least 3 hours, but it's even more than that, because the studies have shown that you really need to look at when your next meal is the next day. And I would say that the very minimum is to have a 13-hour period of time where you're not consuming anything. So 13, 14 hours of fasting, that would mean about a 10-hour window where that is where you do your eating. So if you get up in the morning at around if you get up in the morning around 6 or 7, you eat at around 8, you start the clock, and you should not really eat anything after 10 hours from that first morsel where you break your fast. And by the way, that's known as breakfast.
Okay. That sounds a lot like time-restricted eating. It's not that different, is it?
It's very simple. It's very similar, yes.
Dr. Schwelt, when we talk to people who are exercise specialists, and we say, what's the best time of day to exercise? They basically say any time of day that you can exercise is a good time. But we have also heard that if you exercise too late in the day, it might disrupt your sleep. Is there anything to that?
Yeah, that is both correct. And so again, this is sort of like the dichotomy where we say the best thing that you can do is not expose your eyes to light at all. And the second best thing is to have the blue blockers and the orange tint to the screen. And then the worst thing is doing nothing at all. Here I would say the very best thing to do is to exercise in the morning. It's a very good signal for your circadian rhythm. It also gives you all of the benefits of exercise, for which there is lots. However, if it's in the evening time and you have not exercised, I still think that exercising even in the evening time is better than not exercising at all, with a caveat that if somebody has an issue with circadian rhythm, if they have an issue with falling asleep, difficulty with insomnia, to the point where exercise in the evening is going to exacerbate that, then that might be an individual who may need to reconsider and maybe really trying hard to get their 3 days a week at least of exercise in the morning time.
We had a chance to talk to Dr. LaPuma recently, who has written about the importance of exercise. He also emphasizes the importance of morning light. He says when you get up in the morning, if you could go for a walk and look at the trees and the birds and, get a little morning sunlight, that's really good for your health.
Actually, he says you should do that before you have your coffee.
Yeah, your thoughts?
Well, the reason why I agree with him is because what you're doing there is you're really doing so many things that are good for you at once, that for people today who are so busy and they want to get all of these good things in the shortest amount of time possible, it's killing not 2 birds, 3 birds, maybe 4 or 5 birds. And I'll tell you why. It's because that when you get up in the morning and you're outside, not only is that the time of day where the sun has the least amount of ultraviolet light, so for people who are not getting out and maybe their skin is naive to ultraviolet light, that's the best time to get out. It's also the time of day that is the coolest. It's also the time of day that's the most comfortable to exercise. It's also the most, you're also getting the circadian value of visible light to your eyes, in addition to the infrared light to the rest of your body at that point, at that time of day. And then, of course, you're outside. There is actually evidence that when you're around trees in the morning time or even any other time of the day, there are phytoncides that are given off from those trees. You're much more likely to exercise than you would be inside your house. And you're getting fresh air, which is not only replete with all of those phytoncides, but is also the lowest in carbon dioxide, especially in the morning time when you spend all of this time inside the house building up the CO2 level. So I see all of these vectors lining up, pointing all in the same direction, that show that getting outside early in the day before 9 o'clock and exercising and breathing and being around the trees and in the sun has so many benefits that I really don't see a better time of day to do any of this.
I've got one last question before the break. Napping. A lot of people start to get, shall we say, a little sluggish, a little tired, a little wiped out, middle of the afternoon. Oh, I'll just close my eyes for a few minutes. And, half an hour later, wait a minute, what happened? And they wake up. And then when it comes time to go to sleep, they have a hard time falling asleep or staying asleep. Is there any problem with napping and sleep?
Yeah. So the problem is that as soon as we get up in the morning, there is a substance that begins to accumulate in our body. It's called adenosine. And as adenosine starts to accumulate in our body, it starts to make us generally more and more sleepy. If we take a nap during the day, that adenosine levels will start to go down. It'll start to go in the other direction. Now, this is not, of course, the only thing that determines how we sleep or when we sleep. There's a whole nother circadian aspect to this. And that's why we feel kind of sleepy in the afternoon, by the way. It's a natural thing. And there's whole societies that are based on siestas and sleeping in the afternoon. But the problem is that if you have difficulty falling asleep at night, probably one of the worst things that you can do is take a nap during the day, because you're going to reduce one of those chemicals, which is adenosine, which is going to be your friend at night that's going to help you try to get to sleep. So if you nap, that's going to be gone. It's not going to be available for you at night to the same degree that it would have been. However, for people who have no problem falling asleep and they want to take a nap during the afternoon, I have no problem with that. And I don't take that away from them, especially if it's a cultural thing, if it's something that they do, it's part of their routine, they feel better in the afternoon, no problem. But for my patients and for those who are listening who have difficulty falling asleep in the evening time, I tell them to try to avoid taking naps because it's going to help them fall asleep easier that night.
Okay. When we come back from this break, we're going to ask you how we can fall asleep and how we can stay asleep.
You're listening to Dr. Roger Schwelt, Associate Clinical Professor at the University of California, Riverside School of Medicine and Assistant Clinical Professor at the School of Medicine and Allied Health at Loma Linda University.
After the break, we'll find out if there's an easy way to fall asleep. Or do more of us need sleep training?
Some people do learn to have trouble sleeping, so they have to unlearn that. How can we fix that problem?
We need to remember there's no quick fix. Some people like PM pain relievers, but the diphenhydramine in them has a handful of downsides.
Sometimes people fall asleep easily, but they can't get back to sleep after waking up at 3 a.m. What can they do?
We'll also find out about sleep apnea and circadian rhythm problems.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
A burst pipe, a dead water heater, the AC calling it quits. Who do you call? HomeServe is an easy way to handle unexpected home repairs with plans covering stuff basic homeowners insurance usually won't. Instead of scrambling for a contractor, you make one call to get the repair process started. Join the millions of customers who trust HomeServe right now. Go to homeserve.com/podcast for 50% less your first year. That's homeserve.com/podcast. Savings compared to renewal price. Void in Florida.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by Sonu, an FDA-approved drug-free treatment for nasal congestion and runny nose, using sound instead of steroids. More at getsonu.com. That's getsonu.com.
And by Spatial Sleep, a non-drug approach to help you fall asleep and stay asleep without medications. More information at spatialsleep.com.
Today on the People's Pharmacy, our topic is how to reset your sleep. How can you fall asleep and stay asleep without sleeping pills?
Our guest is Dr. Roger Schwelt. He's an associate clinical professor at the University of California, Riverside School of Medicine and an assistant clinical professor at the School of Medicine and Allied Health at Loma Linda University. He's co-founder and presenter for medcram.com, a site that offers concise and easy-to-follow online medical videos on a range of health topics.
Dr. Schwelt, people want to know how to fall asleep. Is there an easy way to do this, or do you have to do sleep training to learn how to fall asleep?
That's a very good question. And the answer to that is yes, sometimes we have to untrain people how to fall asleep. Let me give you an example of what I'm talking about. Imagine you've been fired or hired or married or divorced. Some big stressor has come into your life. It's a natural response not to be able to fall asleep. That's how our body deals with things naturally. And it's not a problem. These things usually wear off after a few days. The problem happens, though, in most cases where people start to adapt bad behaviors so that it perpetuates their inability to fall asleep. I'll give you an example. Someone can't fall asleep for a couple of days. They realize that this is not a good thing. And they say, you know what, tonight I'm going to go to bed earlier so I can get more sleep and make up for the sleep that I didn't get. Well, we know that when you can't fall asleep, you're going to feel worse. And if you go to bed at a time that you're not sleepy, that your circadian rhythm has not deemed the time to fall asleep, there's only going to be one outcome to that, and that's going to be being even less likely to fall asleep. And so what this does is it builds up behaviors and it builds up anxieties. And all of a sudden now, something that you would be so easy to do is now something you have to think about. You almost have this anxiety, performance anxiety. Imagine going out onto Carnegie Hall stage, but instead of playing the piano, there's a bed and you're asked to fall asleep in front of thousands of people. This is what the issue is. And it's literally every night it's a performance. I talk to patients and this is exactly what they tell me. And when I tell them this, their eyes light up because they say this is exactly the problem.
So how do we overcome this problem?
Because most of us aren't going to go and fall asleep in Carnegie Hall on the stage. Most of us are going to stay away from Carnegie Hall stage in any event, in any
Exactly.
circumstance.
So this is what happens. They go into the kitchen. They're sleepy. They're ready to go to sleep. And as soon as they go into their bedroom, they're wide awake and they can't fall asleep. And what they've done is they've associated all of their performance failures with that room. And this is a cognitive behavioral therapy type of situation where we have to tell them, don't try to go to sleep when you're not sleepy. If you're not sleepy, get out of your bedroom. Don't associate these failures with that bedroom. Stay outside, read, do something else until you're sleepy, then go back into the bedroom. So that's just one of the things that we do. And it's basically this behavioral demodification that we unravel and peel the onion from the outside in of these many, many layers. So there is no, unfortunately, I can't tell you a quick fix, but I can give you an example of behaviors that people adopt and how we have to unravel those. And usually this is done in a clinical setting. And the term that we use is called cognitive behavioral therapy for insomnia. So this is just one of those things that we do. Another one is a sleep diary, where we have them map out all of the hours of the night when they're awake and when they're asleep, and see if we can see, is there a circadian rhythm aspect to this? Is it not? Another thing that we do to help them sleep is to give them confidence. So if the problem is that they have lack of confidence falling asleep, and that's leading to a perpetuating problem, then we need to give them confidence. And so sometimes that might include giving them a sleeping pill for a few weeks in the acute phase of insomnia to make sure that they don't feel like they've lost their ability to sleep. It may also be sort of in a way of only allowing them to sleep for a few hours at night, so that they're so sleepy the next day that when they go to sleep that night, they fall asleep much easier. They feel more confident. They're no longer having anxiety. And we start to move back slowly those periods of time. This is called sleep restriction therapy, and it really should be only done under supervision. But you can see there just a little bit of a flavor of how in an interview process, we peel out exactly what's going on, what we think are the maladaptive behaviors that have led them to this point, and then try to undo those. It's not a quick fix. It doesn't happen overnight. Sometimes they feel worse in the short run, but eventually, more than any other intervention known in the medical world, the one intervention that works the best and the longest is these non-pharmacological cognitive therapies that get people back on their feet.
Well, I'm really glad you stressed that, because you have said a couple times that there is no quick fix, and a lot of people are looking for a quick fix. So I want to read you a comment that we got from a listener. This person says, I have a hard time falling asleep without an over-the-counter sleeping pill. Diphenhydramine makes me anxious and restless at the same time the drowsiness hits. It's very uncomfortable to be falling asleep at the same time my mind is racing and my body is restless. Is there something safer? And this person specifically asked about magnesium. But tell us a little bit more about diphenhydramine, because I'm not sure people realize just exactly how common it is and how many people are using it.
Well, it's in every over-the-counter PM pain reliever. So Tylenol PM, Advil PM, Aleve PM, you name it. If it's got PM, it probably has diphenhydramine.
Yeah, so we have to get into a little bit of chemistry. There are a number of neurons in your brain that are, some of them are activating, that cause you to be awake, and others are deactivating. Some of them cause you to be asleep. There are two specific types of neurons that I'll talk about. One of them are called histamine neurons, and the other ones are called acetylcholine neurons. And both of these are activating. What diphenhydramine does is it basically blocks the effects of these two neurotransmitters. So they're antihistamines and they're anticholinergics. And so you get an immediate type of ramping down of the activation. It's not necessarily the best type of way to fall asleep, but it does take away that activation. The problem is that use over a long period of time in some studies have been associated with an increased risk of dementia and cognitive problems. And it should be no surprise that some of the medicines that we actually use in people with cognitive decline are actually designed to enhance the acetylcholine and the cholinergic neurons in the brain. So really what we're doing here is we're using a shotgun approach. And instead of explicitly focusing on the issues that are causing someone to not to be able to fall asleep, that could be very easily fixed surgically with a very surgical precision, we're using a shotgun approach here of just knocking down all of these neurotransmitters, some of which are very beneficial for us in very good ways, and just kind of knocking it out.
So your recommendation when it comes to using the PM pain relievers as a sleeping pill?
Not to use them at all. Yeah.
Okay. I have a confession to make. I ran a sleep study many, many years ago, a drug that you have probably never seen called methaqualone. It was known by the brand name Quaaludes. It was eventually pulled off the market. But in this study, we required the volunteers to assert that they had at least 2 to 4 hours of insomnia every night. So they had to qualify for the study by just having terrible sleep. And they all absolutely swore that, I have terrible insomnia. And so I would be in charge of supervising them in the sleep laboratory, and I'd be welcoming them back to life, so to speak, in the morning. And I'd ask them, well, how did you sleep last night? And they'd all say, oh, it was terrible. I didn't get a wink of sleep. I was awake all night. It was miserable. And then I'd look at the sleep tracings, the EEGs, and they were asleep like 7 or 8 hours. And I'm going, why in the world do these people swear that they had such a terrible night's sleep when they were obviously fast asleep for a good part, if not most of the night? Have you ever encountered anything like that?
Yes. In fact, there's a diagnosis called paradoxical sleep, where people will say that they only slept 1 or 2 hours, but you can show very clearly on the EEG that they are in sleep. They're in either stage 2, 3, or REM sleep, maybe stage 1, which is sort of a transition phase. But you can clearly see that they are sleeping. And for some particular reason, they don't believe subjectively that they're getting the amount of sleep that they're actually getting. And it's not common. I certainly wouldn't diagnose this on the first visit. This is sort of a diagnosis of exclusion where we actually have objective data, like you mentioned, with the sleep study. But it can happen, and we do see it.
What about people who say, I have no trouble falling asleep, Dr. Schwelt? I mean, a couple of minutes and I'm out. But I wake up at 3 o'clock in the morning and I can't fall back asleep.
Yeah, so that's a very important sign that we look at, and it's the 3 o'clock in the morning, it's the 2 o'clock in the morning, and oftentimes, and I'm not saying that this is a definite, but this is something that often comes up, is whereas slow wave sleep or delta sleep is very prominent at the beginning of the night before midnight. The type of sleep that we see after midnight is REM sleep. And REM sleep is a very interesting type of sleep. It looks almost like, electrically, it looks like you're awake. People are dreaming during this time. It's called REM because of rapid eye movement. It's also very important to understand, too, that during this type of sleep, people are absolutely paralyzed, or at least they should normally be paralyzed, which is important because if they are dreaming, we don't want them acting out their dreams. But a very interesting consequence of this paralysis is that people with obstructive sleep apnea will present with worse symptoms during REM sleep. And it's because that the neck muscles that are keeping the airway open also become paralyzed. And so sometimes what we'll see is people who are right on the edge of sleep apnea and will only get significant sleep apnea when they're in REM sleep. And so they'll be fine for the beginning of the night. But when REM sleep rolls around, they obstruct, their oxygen levels drop, and they arouse as an emergency measure out of that sleep. And so in these type of people where they have multiple arousals, even though they're able to fall asleep without a problem, I will do some studies on them, overnight studies, to see if, in fact, this is exactly what's going on.
Well, we'll ask you about sleep apnea in a moment, but what about someone who doesn't have sleep apnea and who's waking up at 2 or 3 in the morning and saying, gee, I just can't get back to sleep again? What should they be doing?
So again, it's complicated because I can already think of a number of things that I would ask them to further delineate. For instance, if they had a severely advanced circadian rhythm, so in other words, they feel very sleepy at 6 o'clock in the evening. This is very common in elderly folk. And even though they feel sleepy at 6 in the evening, they won't go to sleep because socially it's unacceptable, or they have a loved one that's not going to sleep until later. And so they're being, quote, kept up. And they finally go to sleep late into their, quote unquote, night. And so because their circadian rhythm is so advanced, they're waking up at 3 in the morning because that's when they normally would wake up. And of course, in these people, we try to delay their sleep circadian rhythm to fix that. Another possibility could be something as easy as a train that's going by at that hour and waking them up. So there's not one simple, this is the problem for everyone who's waking up at 3 o'clock in the morning but can go to bed easily. We have to narrow it down. We have to pare it down, peel the onion, as it were, from the outside in to really find out what it is that's going on.
So I do want to ask about sleep apnea. How would you know that's your problem, and what do you do about it?
Oh, this is the $1 million question, because how do we screen for this? So many people believe that, and it's true, people who are male, people who are obese, have thick necks, who snore, these are the people that have sleep apnea. And there's no question, it's true. Those are the ones that are more susceptible. They typically have excessive daytime sleepiness. They fall asleep easily while watching TV, reading a book, or God forbid, even driving. But there are a whole swath of people, and I like to call this the iceberg disease. You see the little iceberg on the top, but there's a huge amount of people under the surface that are struggling with this that we don't know because they don't have classic symptoms. Women, particularly, don't have the classic symptoms of excessive daytime sleepiness. They may have fibromyalgia. They may have fatigue. They may have muscle aches, morning headaches. These are all signs that are well documented that are consistent with obstructive sleep apnea. They may not even snore, but if they're not getting appropriate sleep at night, this can lead to sleep fragmentation, which can lead to not only excessive sleepiness during the day, but also cardiovascular complications. And just to sort of tell you exactly what this is a situation where you're sleeping, your airway falls asleep, and because of that, it collapses. No air can get into your lungs. Your oxygen levels drop, and that forces your brain into an ultimatum of where it either arouses up the rest of the brain so that it can live and get that oxygen, or it dies. And obviously, most of the time, it chooses the former and not the latter. The problem, though, is that the way that the brain wakes up is by sending out adrenaline all over the body. And so blood pressure goes up, heart rate goes up, strain on the heart goes up. And this can occur literally every minute to 2 minutes in very severe, and maybe 4 to 5 times up to 15 times an hour in mild. But this is happening on a nightly basis, and this is the problem.
Dr. Schwelt, so Dr. Schwelt, if you do have sleep apnea, what can you do about it? I keep seeing commercials on television for some device that they never completely explain, where they say, well, you can get rid of your sleep apnea machine. We're going to implant something magical, and no more tubes and no more problems. You'll be set for life. So first, what is a sleep apnea machine? And B, what's this newfangled thing they're advertising?
Yeah, so because the problem in sleep apnea is a mechanical problem of the airway closing, there's many devices that can open that up and prevent that closure. A CPAP machine or a sleep apnea machine is simply a device that fits over the nose and or the mouth to provide a gentle pressure that inflates the airway and prevents it from closing. Think of it like you're inflating a flat tire. It's non-invasive, and it keeps the airway open. It's probably the most studied and probably the most effective way of doing it. For those people that cannot tolerate CPAP for whatever reason, because of just inability to put the mask on, claustrophobia, or whatever, and they have moderate to severe sleep apnea, where we're really interested in reducing their risk of cardiovascular disease, one of the things that can help is by taking the tongue, which of course is attached to the jaw, and moving it forward and off the back of the throat, because many times it's this part of the anatomy that's causing the problem. Well, the nerve that does that motion is called the hypoglossal nerve. It's a nerve that makes your tongue basically stick out. If you were to stick your tongue out at somebody, you're using your hypoglossal nerve. So if we have an implantable device that can sense every time you're taking a breath in, that we can turn on right before you go to sleep, and then send a wire up into your neck to stimulate that hypoglossal nerve, it's going to help every time you take a breath in to move that tongue anteriorly or off the back of your throat so that it can open it up and actually get it in. And the studies have shown, and it's FDA approved, that it can significantly reduce the number of times that somebody stops breathing at night. But again, it's not as effective at CPAP, but if you can't tolerate CPAP, it's better than nothing.
How do people feel about it? I'm assuming you've seen some patients who have had that procedure.
Yeah, just like anything else, there's people that love it. There's people that don't love it as much. The one thing that I should tell for people who are interested in getting it, there's a number of hoops that you have to jump through. Depending on your insurance, you have to have a body mass index of less than 35. Some would say even of 40. You have to show that you cannot tolerate CPAP. You have to have a full overnight study. And then there's one other thing that I'm just going to mention, is that they take you to the operating room before they do this procedure, and they put you to sleep using propofol. And they watch how your airway collapses while you're sleeping. If it collapses in an anterior-posterior way so that it's actually like just literally falling back, which is usually about 80% of the time, that's a good sign that this device is going to work. If, on the other hand, it collapses in a circumferential way, where it's radially from all directions collapsing, then that's a sign that it's probably not going to work and you won't be a good candidate.
Dr. Schwelt, tell us about Zolpidem. The brand name is Ambien, and a lot of people have relied on it for a very long time. I've got a question. I cannot sleep without a high dose of Ambien, Zolpidem, which I've been taking for years. I don't nap during the day. When Ambien stops working, as it occasionally has, I sometimes stay awake for 6 or 7 days straight. I now take Zolpidem and Trazodone at bedtime, along with NyQuil, severe cold and flu. This combination works most nights, and I do not wake up for 6 or 8 hours. But I do remain exhausted most days, but at least I'm sleeping. Thoughts?
Yeah, this is really an interesting dilemma. And it demonstrates what the problem is with sleeping medications, is that generally speaking, you have to use more of them and higher doses. And it's the reason why that the recommendation is to use it for about 6 to 8 weeks and then stop. And in the meantime, during those 6 to 8 weeks, you're doing cognitive behavioral therapy for insomnia. Now, obviously, just because they didn't follow those guidelines, what do you do with someone like that when they come to you? And generally speaking, the first thing that I do is I never turn down the number of medications that someone is using. I try to fix the problem using, as we talked about, cognitive behavioral therapy. And the reason why I don't do that is because if I take away those medications, they're going to rebound in the other direction, and it's going to take away any kind of confidence that they have to fall asleep. It's literally the last thing that I do. Once they're sleeping better, I start to slowly titrate down those medications. But the reason for this is important, that there's been some studies that have shown associations with the use of these medicines long term, especially the Zolpidem, where we have an increased risk of death. In fact, these medications, when they're used for an extended period of time in people, can have bleed over effects the next day. There's been a number of FDA guidances on that and updates in terms of accidents, driving, people doing automatic behaviors. I remember the story of one of my patients where they didn't realize this, but they got up in the morning and they fixed a sandwich for their for themselves or for their husband, I can't remember which, and then they would go back to bed and they wake up in the morning and there was a sandwich already made for them in the morning. They had no idea how that sandwich got there. And what was happening is they were doing these automatic behaviors and forgetting that this was actually happening. So there's a lot of issues with chronic use of even FDA-approved medications for chronic insomnia. My approach is using all of the other tools that we've talked about on this show to help them sleep better. And when we are doing that, that's the time that I start to titrate down the medications when they have the confidence and the ability to fall asleep.
That is all the time we have. Thank you so much for telling us about sleep apnea. It's a signal to see a sleep specialist such as yourself.
Dr. Roger Schwelt, thank you so much for talking with us on the People's Pharmacy today.
Thank you so much.
You've been listening to Dr. Roger Schwelt, Associate Clinical Professor at the University of California, Riverside School of Medicine, and Assistant Clinical Professor at the School of Medicine and Allied Health at Loma Linda University. He is co-founder and presenter for medcram.com, which presents medical videos clearly explained. Dr. Schwelt is quadruple board certified in internal medicine, pulmonary diseases, critical care medicine, and sleep medicine through the American Board of Internal Medicine.
Lynn Siegel produced today's show. Al Wodarski engineered. Dave Graydon edits our interviews. B.J. Liederman composed our theme music.
This show is a co-production of North Carolina Public Radio, WUNC, with the People's Pharmacy.
Today's show is number 1480. You can find it online at peoplespharmacy.com. That's where you can share your comments about this episode. You can also reach us through email, radio@peoplespharmacy.com.
Our interviews are available through your favorite podcast provider. You'll find the podcast on our website on Monday morning. This week's podcast has additional information on what to do about sleep apnea, what we were just discussing at the end of the show. What's the new alternative to a CPAP machine?
At peoplespharmacy.com, you could sign up for our free online newsletter to get the latest news about important health stories. When you subscribe, you also have regular access to information about our weekly podcast. If you've always wondered what we look like or you wanted to watch our guests as well as listen to them, we have started posting our videos to YouTube. Just search for People's Pharmacy.
If you enjoy the People's Pharmacy podcast, we'd be grateful if you'd write a review of the People's Pharmacy and post it to the podcast platform you prefer. If you find our topics thought-provoking, please share them.
In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thanks for listening. Please join us again next week. Thank you for listening to the People's Pharmacy podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.